Hello everyone. Today we are going to learn the topic is Neuro Assessment Part 2. I am Minoli, tutor of M College of Nursing. Let's see the objectives what we are going to discuss. Motor system. So here the motor systems examinations includes assessment of bulk, tone and power of major muscles group of the body. So the following things is are assessed in examinations of muscles like size of the muscle, strength of the muscle, tone of the muscles and any involuntary movement. Coming to muscle size. Inspect the muscles group of sizes. Compare the right side and with the left side also. So look for the asymmetric of the muscle sizes, and when measuring the extremities in centimeters, 1 centimeters or less is not significant. And abnormal findings are, for example, atrophy and kyphotrophy. And atrophy means a small muscle wastage appearance due to tissues and injury and lower motor neuron lesions such as polio affected and diabetic neuropathy like that. And hypertrophy sometimes increased size with isometric exercise. Now we are moving to the muscle strength. Here observe the patients getting up from the chair and walking, and test upper limb power with the patient sitting on the edges of the couch. Test lower limb power with the patients reclining, and ask the patient to lift their arms above their head, and ask them to play the piano and check the movements of the fingers. An asymmetrical loss of the fine fingers movements may be a very early sign of cortical or extra pyramidal disease. And then observe the patients with their arms outstretched and supinated, palm ups, and their eyes closed for pronator drift, and when one arm starts to pronate. And muscle strength should be equal bilaterally. To understand muscle strength grading scales. So here for grade 5, which means full range motions against gravity, full resistance. So the percentages to give 100 percentages, which is called as assessment a normal one, and the grade 4 is a full range of motion against gravity, some resistance will be there. So here the 75 percentages can be accepted, and for the assessment can be good. And for grade 3 is a full range of motion with the gravity, and here the 50 percentage of percentages can be accepted, and which is called it as the assessment a fair one. And to grade 2 is full range of motion with the gravity eliminated, passive motion, and here the percentage is 25, and the assessment which is called it as poor one. And the grade 1 is a slight contractions if it is there, to give the percentages 10 percentages assessment which is called it as trace. And for the 0 grade, no contractions will be there though, so there is no percentages, and the assessment also 0 1. Coming to muscles tone. So here tone is the normal degree of tension in involuntary relaxed muscles. It shows a mild resistance to passive stretch, and first persuaded the persons to relax completely. So then move each extremity smoothly through a passive ROM exercise. Support arm and at the elbow and the leg at the knee. So normally you will note a mild even resistance to the movement. To find the abnormalities in the muscle tone. So for example, if a condition flaccidity, so which means a decreased muscle tone and hypotonia, so which is associated with some peripheral neurotics, polios and Guillain-Barré syndromes and cerebrovascular accident and spinal cord injury. And other condition, the spasticity, which means increased tone or hypertension, and increased resistance to the ROM exercise, so which is associated with upper motor neuron injury, examples paralysis with the cerebrovascular accident. And the conditions rigidity, which is called it as a consistent state of resistance like dystonia, so which is associated with the injury to extra pyramidal tract, example basal ganglia with Parkinsonisms. And then the conditions cog wheel rigidity, which means in which increased tone is released by degrees and during ROM. So it feels like a small regular rigidity which associated with Parkinsonism. Coming to the cerebellar functions. So here first we need to check the balance test, which means a gait. It is tested by assessing the balance and coordination. For the gait, observe the person walks 10 to 20 feet and return to the starting point. So here normally the person moves with a sense of the freedom. Opposing arm swings is coordinated. But step length is about 15 inches from the heel to heel. So ask the person to walk straight in a heel toe fashions and tendon walk. What are the abnormal findings can be expected in the gait? So the patient sometimes stiff and immobile posture and staggering or reeling and wide-based foot and lack of arm swings and unequal rhythm of steps and stamping the foot and ataxia, which means uncoordinated or unsteady gait, and crook link walk will be there. So these are the abnormalities we can consider as a gait abnormal. Cerebellar test 2, standing on one foot with eyes closed. So here ask the patient to close his eyes and stand on one foot and repeat on the other foot. Stand close to their client during this test. So here the normal findings can be expected. Maintains stance for at least 5 seconds. Deviation from the normal findings. So here they cannot maintain stance for 5 seconds. In a cerebellar test, third one, a rhombics test. Here to ask the patient to stand with the feet together and arms resting at the sides. First with the eyes open, then closed one, and stand closed during this test for about 20 seconds to check. What are the normal findings can be expected in the rhombic test? The patient having a negative rhombics, so may say is a slightly but is able to maintain the upright posture and foot stance. And abnormal findings like positive rhombics cannot maintain foot stance, moves the feet apart to maintain stance if client cannot maintain a balance with the eyes shut. And client may have sensory ataxia, lack of coordination of the voluntary muscles. So if balance cannot be maintained whether the eyes are opened or shut, client may have a cerebellar ataxia. Coming to the heel toe walking, so here ask the client to walk with a straight line, placing the heel on one foot and directly in the front of the toes for the other foot. Normal findings are the maintains the heel to walking along a straight line. For the deviation from the normal findings, assumes a wider foot gait, stay upright position. Cerebellar test, fifth one is coordination and skilled movement. So here rapid alternating movements, like ask the person to pat the knees with the both hands, then ask to do it fastly, and alternatively ask him to touch the thumb to each finger on the same hands and starting with the index finger, then reverse directions. And what are the abnormal findings can be seen in this coordination one? So lack of coordination can be seen, and slowly clumsy and sloppy response termed as dysdilato-coccinea. Finger to finger test. So here ask the client to spread the arms broadly at shoulder height and then bring the fingers together at the midline. So first with the eyes open and then closed. First slowly and then rapidly. So for the normal findings of the finger to finger test, performs with accuracy and rapidly the patient will do. For the deviation from the normal things, so moves slowly and is unable to touch finger consistently can be seen. Finger to nose test. So here ask the client to touch the nose and then index finger held at a distance about 45 centimeter or 18 in, and at the rapid and increasing the rate also. So here the normal findings performs with accuracy and rapidly. So deviation from the normal one moves slowly and is unable to touch fingers consistently. Heel to shin test. So here test the lower extremity coordination by asking the person to place his heel on the opposite knee and run it down the shin from knee to ankle. And normally the person's moves in the straight line down the skin. For the abnormal findings can be seen in the heel to shin test. A lack of coordination will be there, and heel falls of shin sometimes can be expected. Coming to sensory system. So here to finding the sensory functions, so evaluation of the light touch to do first. So here use sweeps of the cotton to touch the skin lightly on the both sides of simultaneously. So here then test the several areas of on both the upper and lower extremities. Ask the patient to tell you if there is a difference from side to side or other stand sensation. Testing stereogenesis using a coin one. Here place the familiar objects in the patient hand like a coin or paper or pencil or etc. something. So ask the patient to tell you what it is to finding the stereogenesis testing. And the next one is testing the graphesthesia. So here number identification. So here with a blunt end of the pen or pencil, draw a large number in the patient's palm. Ask the patients to identify the number to finding the graphesthesia things. The reflexes. So here involuntary contractions of the muscles groups in response to stretching near the site of the muscles in session. There is two types of reflexes are there: deep reflexes, superficial reflexes. In for example, deep reflexes to do the biceps reflexes, triceps reflexes, and brachioradial reflexes, and patellar reflexes, and then angle reflexes. And coming to the superficial reflexes, abdominal reflexes, and then chiasmatic reflexes, and plantar reflexes, and perianal reflexes. Testing the biceps reflexes. So here the patient arm should be partially flexed at the elbow with the palm down. Place your finger, thumb finger, and firmly on the biceps tendon. So strike your finger with the reflex hammer. So look for contractions of the biceps muscles and slight flexions of the forearm. And the normal findings can be seen in this reflexer. Contraction of biceps with a flexion of forearms with call it as +2. Okay, so this is testing the triceps reflexes. So support the upper arm and let the patient's forearm hang free. Strike the triceps tendon above the elbow with the both side of the hammer. So observe the contractions of the triceps muscles with the extension of the lower arm. So here for the normal findings is all contraction of the triceps with the extension at elbow +2 will be there, which is called it as triceps reflexes will be normal. And coming to the testing the brachioradial reflexes, have the patient test the forearm and the abdomen or lap. So strike the radius about 1 to 2 inches above the wrist and watch for flexion and supination of the forearm. And normal findings like flexion at elbow and supination of forearm, and also you may notice flexion of fingers like +2. The final one is the testing patellar, like a knee reflexes, like client in a sitting position only we can do it, and have the patients sit with a knee flexed position and strike the patellar tendon just below the patella. So notice a contraction of the quadriceps muscles and extension of the knee. And for the final one is testing the Achilles tendon reflex with the client with sitting position and dorsal flex the foot at the angle. Strike Check the ankylos's tension and watch the feel of blunder and flexions at the ankle, and normal findings blunder flexions of foot +2. Blunder reflex. Here the blunder or Papkin's reflex is superficial one. Use the moderately sharp objects such as the handle of the percussion hammer, a key or a applicator stick like that. Stroke the lateral border of the sole of the client's foot and starting at the heel continuing to the ball of the foot and then proceeding across the ball of the foot towards to the big toe. In that normal findings of the blunder reflex, all five toes is bend downwards and this reaction is a negative Papkin's. For the deviation from the normal findings, in an abnormal positive things, the Papkin's responses, the toes spread outward, the big toe moves upward. So Papkin's responses dorsiflexions of big toe without a fanning of other toes. In absence of the drag or alveolar intoxications, it suggests pathology involving upper motor neurons. Facial reflexes, abdominal reflexes like and anal reflexes and cremastic reflexes. And abdominal reflexes stroke a patient abdomen diagonally from upper and lower quadrant towards the umbilicus to finding the normal one, contractions of rectus abdominis, umbilicus moves towards the stimulus. And the anal reflexes gently stroke skin around anus with cloud one fingers. And the normal findings here seen anus buccus. Coming to the final most one, cremastic reflex here gently stroke inner aspects of the male thigh to see the testes will be rising, which is the normal findings of the cremastic reflex. You all understand about the motor functions and sensory functions and cerebellar functions and reflexes. Thanks for watching.